Hello, everyone. Welcome to World City and today's conversation on community health, placemaking, belonging, and well-being. I'm RIMMA BOSHERNITSAN, CEO of Dialogue, a strategy advisory working at the intersection of people, technology, and society. And today we're joined by three amazing guests. JODIE Lesh, who has over 30 years of experience to transform the healthcare industry as we know it today. John Powell, whose deep expertise in understanding us in relationship to ourselves, our communities, and our infrastructures has guided many in forming a deeper understanding of what it means to belong and what it means to be human in this time. And Pablo Lazo, whose deep expertise in urbanism and urban planning is shaping equitable design solutions in cities worldwide. I'm so excited to have you all. Welcome.
Thank you.
Thank you.
So,
Thank you.
So we are, we've been through so much over the past 2 years, and the notion of what our communities need to be and could be, and how we nurture them, how we design for them, how we think about our needs in relationship to our families, to our communities, our neighborhoods, and so forth, have shifted so much. And I would love to to start us off, ask you to expand a little bit about your circle of concern. Like, what do you spend your time on? What is driving your passions? And what are you thinking about in your work right now? And we can start.
I can start. So just, coming from the healthcare industry, I guess the things that concern me the most are sort of three things that I see in healthcare that I think really need to be upended. One is that healthcare has been very historically monolithic. Not the relationship between the doctor and the patient, but just the whole system itself versus on a human scale. I think that's a problem that keeps me up at night, and I think we need to really address. The other is that we've created pretty kind of hard boundaries around ourselves. So when you think about a hospital or you think about a clinic, it's very contained. We're in the community, but we're not necessarily part of the community. And I think one of the challenges that I think about is, how do you create more porous boundaries between who we are and where we are in our place and what the needs are of the community. And then the last thing I would say is that healthcare has been really episodic. When you're sick, you go in, you get treated. And now we're realizing that it's the entire spectrum of social needs, as well as people's healthcare needs, that determines whether somebody has well-being. Not just if they're well, but if they have well-being. And I think that's something now at Kaiser Permanente we've really been tackling, looking at the economic, social, and the environmental conditions in the communities in which we serve. And so those are the three things that I think need to be changed, and we need to have a very different lens, a very human lens, a community-centric lens, in order to really challenge those orthodoxies that have been around for a very, very long time. So from my perspective, these are kind of the guiding forces that let me challenge the status quo and make change, at least within our organization.
Yeah. Pablo?
Sure. Well, from my work and over the last 25 years, my focus in understanding urbanism is to understand the relationship between people and the space, the cities where people interact, and trying to understand and depict the actions and the effects that we as humans have on the built environment is fundamental to trigger processes in urbanism and urban planning that could enable us to create better cities, more equitable cities, cities that are more resilient, cities that do take into consideration the views of the community and not only a sort of top-down decision-making. So I believe, and the last decade of my work has been focusing on three things. One is to open up the process of urban planning through participatory process, through co-decision-making design exercise, so that people get to understand how difficult it is to plan cities on the one hand, but also how important it is to take their views into consideration for policymakers, for architects, for planners, for engineers. The second thing that it's important is to start understanding that there are non-spatial elements that are very, very relevant when we try to design or regenerate a piece of city or a community. And for example, touching what Jodie just mentioned, the relationship between public health and the built environment is becoming more evident, with a lot of research being done in the last 5 years that demonstrate that actually the way we plan our cities and the way we shape primarily our public space will have a substantial impact on public health for the inhabitants in cities. So the relationship between those two has been now very important and critical, and COVID-19 has accelerated the process of understanding how we can shape better cities to address issues of public health. And the third is the kind of behavior change that will involve making our cities better, because we must remember that at least for the last century, people that inhabit cities, they tend to live in a certain way. They consume things, they produce garbage, trash, waste, they consume non-renewable resources such as water, and that has started to change in terms of how we need to be more efficient in terms of resources, be more proactive when we receive a kind of policy that asks us to behave in a different way. So that change of behavior is now also critical when we plan cities. And for me, that is one thing that I'm very, very interested and passionate about, how we can evolve that into future urban planning tools.
Mm-hmm. Thank you.
So I think these, I enjoyed both of what Jodie and just suggested. The heart of the question to me is about people and life itself. And I say people and life because people don't just live with people. People live with trees, people live with other animals, people live with plants. I live in the Bay Area. You drive around the Bay Area and you can tell when you're in a poor area, this low resource, because the first thing you notice, no trees. So how we organize cities, how we plan cities, first of all, the question is, who are the we? The question of who plans, who benefits, and who pays. And in virtually every major city in the country, in the world really, there's a sort of an elite class that everyone lives in the best place with the best climate, with the best views, with the best water. And then the others who, live as they can with the shanty towns or ghettos or barrios or whatever. So I think one, we have to change that. We have to really think about, I think the challenge, yes, in terms of circle of concern, is that everyone is in that circle of concern. So human life is in the circle of concern. And I've been reading Bruno Latour from Down to Earth. Earth itself has to be in that circle of concern. So when we talk about renewable energy, it's not just renewable, that's true. We also think about the relationship to the Earth. So part of it is, how do we belong to each other? And how do we belong to the Earth? And how do we create a circle of concern where no one is outside the circle? Where no one is outside the circle. And the Earth itself is in the circle. And the last example of that is structural. I've written a long article where I talk about, and I'm not anti-corporate or even anti-capital for that matter, per se, but I do feel that when we put corporations in the circle of concern and treat them like people, that people get pushed out of the circle of concern, that you have a misalignment. Instead of corporations serving people, we have people serving corporations. So I think it's the alignment and to sort of facilitate people coming together. I just did one last thing. I live in the United States. We're at the history. We've issued several reports now about segregation, about redlining, about how we've organized space to keep people of different races, different ethnic groups separated. And it's not just separating people from each other, it is that, but it's also separating people from opportunity, separating people from, you can determine someone's life expectancy by the zip code. So we're using space to distribute health.
That's such a beautiful way of creating sort of the horizon to which we all need to kind of strive towards. And I think one of the things that is really interesting for me, and to think about this, not only the notion of the circle of concern, John, as you described it, but also in what Jodie and Pablo was saying is, there's a responsibility and an agency and an intentionality that we all kind of hold to create opportunities for each other, whether it's related to health, or it's related to living, or related to understanding all of the above. And I'm wondering, sort of, if we think about how to evolve from here, as we think about the planning of our cities, the planning of our communities, our neighborhoods, and what that experience might be, can you talk a little bit about some of your perspectives on the intentionality that it takes to create place, this notion of place and placemaking as a means for social medicine? Can we get to this point, John, where the earth is within the circle of concern? And what are you guys seeing right now in your work, individually or collectively?
I think certainly we can lean in that direction. I think it's very simple and very complex at the same time. So you're talking about complex systems. And we know in terms of complex systems, our intentionality is not always clear. Or even when we intend things, we don't always get those things. So part of it is having an iterative process. We try something, it doesn't work. We make a change. We introduce a non-indigenous plant or a rabbit into an environment, and then all of a sudden we have a problem. No one anticipated it. That movie about introducing rabbits, and I think it was in Australia. So part of it is a certain humility. And humility actually comes from the word humus, or earth. So being in relationship. I mean, I think it's planning by itself can invite a certain hubris. It can be like in the head. I think of something. Whereas humility requires relationship. And it's not just thinking, it's also feeling, it's also being in relationship. And so the last thing I'll say is that there's a lot of research suggesting that one of the most important things that people have is having the right relationship and having agency. So if you're just doing something for people and people don't have a voice, you've already diminished the outcomes. For people to have a real voice, to have real agency, they also need certain support. We work, for example, with planning agencies where they try to bring in the community, and the planners are nervous because they're saying, well, the community doesn't really know how to plan. Well, can we fix that? So yes, there's a technique or technology to planning, but that's not a complete barrier. We could address that. So if we understood that part of what we're doing is not just planning physical space, but we're also planning social space, space where people can come together and exercise collective agency.
RIMMA, I was wondering, I would love to share, I just think some of the things that have been said here are so important. This notion, first of all, of humility, I just can't say enough. There's a project at Kaiser Permanente that really comes to mind. And it also this notion of really listening, of not coming in with so many preconceived ideas that the community doesn't know how to plan, which I kind of laugh because the community knows what they need. So therefore they know how to plan. And really being able to listen and hear and not just sort of shed all these preconceived ideas. And really being intentional. And I think if you're not intentional, you slip back into the way in which it's always been done with all its flaws that we've talked about here. When we were planning a clinic in South Los Angeles, fairly disadvantaged neighborhood that quite candidly, we had really unintentionally not served well, I'll be honest. When we looked at the data and had the courage to really look at where we had placed services, we realized that we had, not been intentional about not leaving people behind, and therefore we left people behind. And so the first was really being intentional about coming to that community and serving it. And then, so when we came to South LA and we decided that the right way to do this, and I'm glad we did it, was to really stop in terms of making assumptions about what the community need and go ahead and ask. Just ask, and then listen, really, really listen, and go in with an attitude that we might not hear what we wanted to hear. And, we expected to go in and hear things like, we want, a certain amount of medical services or certain types. And it's actually not at all what people told us. They told us that they wanted green space. They needed free access to Wi-Fi. And then they actually told us they needed jobs. And, that took us down a really important avenue of how could we create this notion of shared value of doing something that obviously helped our business, but also helped the community, and found that intersection. So it took us down a path in terms of economics and jobs of, bringing people into the construction project who had been previously incarcerated and left behind, and help them get into apprenticeship programs and do their training on our site, and helping having commitments to local hiring, both in construction and in the long-term operations of the facility. And those were a very layered strategy, including creating green space, exercise space, free access to Wi-Fi, food services that people could access because there weren't grocery stores, farmers markets, kind of a whole layered strategy. And we would not have gotten there if we would have sort of put this wall around us and said we weren't woven into the fabric of the community. We were rather just this kind of, again, sort of monolithic thing in the community. And that intentionality and that humility to be able to really listen and hear and respond changed everything, and has now created a blueprint for how we plan going forward. But it was not easy. It was breaking a lot of these orthodoxies, and asking people to come along in a journey that they had never been along before. So it's just so interesting to hear the things that you have to say about being intentional and listening and having humility, because I just couldn't agree more.
Mm-hmm.
And it's also taking Jodie's point on how intentionality is transforming, or it's giving us tools to transform cities. I think let's remind ourselves that cities are at the core of the last 200 years of human civilization, and understanding that over that period, pretty much in most cities, you have a lot of parts of the community that are being left behind, with lack of services, lack of voice, lack of integration with many elements that are critical for basic human needs. So I think at this moment in time, the discussion about well-being in cities is relevant, not only because many different groups and different actors in society have realized that it is now or never that model can be shifted to a model that is more inclusive, that addresses that circle of concerns in a different way, as opposed to what has been done before. But also because there is the pressure of climate change, and that is something that is now hitting the nerve of many people at the individual level, because either they suffer disaster effects of climate change, earthquake, fires, flooding, or because there are not enough opportunities for employment, for schools to take their kids nearby. They commute, like in Mexico, in Sao Paulo, 2 hours each day going back and forth, and that is not mentally healthy for people. So understanding that those things are now very high end in the agenda of discussing how to shape cities, I think offers us a big opportunity to shift this paradigm of how we must incorporate those elements at the core of urban planning.
And are you, and this is a question for all of you now, what are you specifically seeing as like there's so many barriers, right, in terms of changing policy, changing how the structures of cities have happened over the past, 200 years, let's say, if not more, depending on what, part of the world we're talking about. Like, how would you, knowing what we know now, knowing what Pablo, what you just said, Jodie, the outcomes of the project that you were speaking to, and John, kind of to your point is of what we would want the ideal state to be, given that like there's so many restrictions, how can we go about to integrate our learnings and our knowledge around what's possible and the ties to well-being and the ties to sort of inequities and equities at the same time? How do we put this all together to actually make these changes happen? And is there examples, and maybe Pablo, this is more specifically towards you, of cities that have made this happen globally that you've seen where they've been successful in this moment of integration?
Well, I think in terms of precedents or good examples, COVID has shown us that we can make changes very, very fast, and we can adapt things in cities. No matter how critical is the process, people can adapt and can shape their basic human needs to whatever kind of impact that situation is causing in their everyday lives, right? So I think that has taught us that, for example, the notion of proximity is something that is going to dictate a lot of the decision-making in planning processes across many cities. And we have seen the famous Paris 15-minute city distance that is just talking about how people can get to basic things in a walkable way or in a near distance-based relationship that does not affect their mental health. And it may not be one size fits all to other cities, but the concept of if you provide these basic needs in a circle that people can walk or can access relatively quickly, that will have a substantial long-term social and economic benefits. It will regenerate local employment, create jobs, revitalize communities, and so on and so forth. And then the other thing that I think is very important is this notion that John was talking about this is a complex system. And now we have to understand that cities are part of a bigger system that are the ecosystems of nature. And there is a lot of research now that talk about if you have a green environment, your mental health can be substantially improved in many ways. So this notion of nature-based solutions, that it's a jargon to talk about, do not build with concrete and hardcore stuff, build with nature elements that are already in your city, is also something that will become a norm and will shape many cities, as it is happening, for example, in Copenhagen, in the north of New York City, around the River Bronx. It's happening in Colombia, in the city of Medellin, with all the river restoration that is changing the way people discharge their water from their houses and living communities that are very poor. But they now realize that if they discharge untreated water, the problem is much bigger. It's affecting others, and that is kind of the circle of concern that I quite like from John. That it is very clear example in urban settings. So I think there are very good precedents, not only in the States, in Canada, also Australia has done some fantastic work with proximity planning, neighborhood scale plans, and that is something that I can see in the future unraveling very different pieces of cities and communities.
I do have to say, though, worried, though. I mean, what we saw in healthcare during COVID with this really very disproportionate impact on largely poor people living in poor communities, I think was concerning. And I guess the question is, how do you dismantle some of the structures that we have that actually contributed to that? So we saw, tremendous household spread among people living in high density housing in kind of our urban core, whether it was the Bay Area or in Atlanta or in the Mid-Atlantic states. And we were sort of scrambling. We were sending people home suppression kits, but the reality is that people were sort of sitting ducks, right, in these environments, these high density housing environments. People who had to do jobs that required them without proper PPE to go into the community. And now one of the things that we're also seeing is that we did pivot very quickly. Most of our care went virtual. But now we're starting to realize that many people were left behind in that this sort of digital equity issue became significant. So we don't necessarily have the infrastructure to create that equity, and we have certain infrastructure that has contributed to inequities. So it's we don't have the luxury of starting over, unfortunately, and we really do. And now what worries me is, we're starting to see people leave the urban core, but not the people who were the most disadvantaged, and now they're left there, potentially with, lack of investment or, potentially lack of jobs. So we saw some very concerning trends during COVID. There's no question about it, around who was impacted and who was spared. And it's, I think it's a rallying cry that we're going to have to address, both the things that need to be there, like digital equity, and the things that we need to do something about, like some of the way in which people are living that contributed to the spread of the disease. So there's concerns.
Yeah, absolutely. And I think the urban equity and digital equity, they tie hand in hand. And like, how do you solve for one and not necessarily solve for the other? You have to kind of tackle both in some ways. And the thought that was going through my mind, Pablo, as you were talking, and I'm like, are we urbanizing, like, is the goal to urbanize suburban environments and then create more natural, opportunities for people to engage with nature? And at the same time, to Jodie's point, that being, let's assume that's done and we've made it happen. We still have to tackle the access to technology, the access to care, the access to basic human needs. And how do we tackle both? I don't know, John, if maybe you have a comment on both of what Jodie and Pablo were saying.
So yes, and I agree very much with what both of them said. I wouldn't parse the issue quite that way. It seems to me one thing I would say is let's affirmatively plan and embrace equity and belonging. And that's different than removing barriers, because we are dealing with complex systems and there's so many barriers. There's so many reinforcing constraints that we were one of the first groups in the country to ask for disaggregated data on race in terms of who was getting the virus. Early on, we just simply didn't have that data. And we had people saying the virus is equal opportunity infector. It just wasn't true. And one of the first places, the first state that disaggregated the data was Michigan. We worked with people in Michigan and Detroit, and people were a little bit shocked to find out that there's this huge disparity. I was not shocked. Part of it is not just having the data, disaggregating the data, but having affirmative goals we're trying to reach. And we started something over 20 years ago called opportunity mapping, where you literally map out the distribution of opportunity in a region and you overlay it with different populations. And you can do that, defining opportunity however you want to. So you can actually define health outcomes. For example, you can measure allostatic loads at the community level and find out where people are actually subjected to stressors that's actually producing negative health outcomes that's geographic. We have that technology right now. We don't have to wait for that. And just to give you two quick examples, we worked carefully with the Met Council outside of Portland. If you know, Portland has urban growth boundaries and sort of limit the growth of sprawl in certain areas. And there was a whole debate as to whether or not that was limiting housing opportunities for low-income communities of color in particular. And so some people were saying, remove the urban growth boundaries, let us sprawl. And sprawl has a whole bunch of negative effects. And some were saying, no, let's keep the urban growth boundaries and displace people. But that was a false choice. And there were many other things you could do, such as you could increase density and build low-income housing. So one of the things, and Pablo sort of touched on this, is you're dealing with complex systems, and it's very important not to just pick on a thing, but look at the relationship between things. And I'll just give you one more example. There are many, but we're doing a project in Minneapolis, and we brought in, which we always do, low-income communities that are often left behind, and talk to them about the kind of communities that they want, and have an experience similar to Jodie's. And we have our own template of, what the opportunity is, how you do this. And they said, we want to know where liquor stores are. We said, liquor stores, who cares? That's not our data set. That's not one of our indicators. But we did it, we're trying to be good citizens. It turned out it was extremely important. And what we found was liquor stores was within a block or two of daycare centers. And what was happening, frankly, was that men were going to liquor stores, getting juiced, and then going to the daycare center, meeting their estranged partner, and there's all kind of domestic violence. And it's like, who would have thought to build liquor stores next to a daycare center? Somebody, I don't know if anyone thought of that, but that's what the practice was. And so I think it's more than removing barriers. Instead of hoping that we have equity outcomes, we have to be deliberate. We have to talk about that. We have to engage people in it. And I think that we have unequal voices. So cities and counties, they're responsive to Kaiser. They're responsive to stadiums. They're responsive to, these big buildings. Look at Detroit. All the buildings going on in downtown Detroit. You go 2 miles outside of Detroit and nothing's happened. And so we also have to make sure, we deliberately make sure people who don't have money and power, their voices are at the table. So that's part of it, making sure they're at the table, not just at the table, but they have the capacity to participate in a meaningful way.
Yeah,
it's interesting. Go on, Pablo, please.
Just wanted to touch upon something that John mentioned. We ran a study at the World Resource Institute on the cost of urban expansion in Mexican cities, and it's a model that it's now going to be replicated in Colombia and Brazil. And the whole hypothesis of the research was to develop a platform that demonstrate how these large urban footprints of dispersed model of sprawl and urban growth is really impacted in the most deprived sectors of communities, because the relationship between how long they take to get to their liquor store or their restaurant or their market or their school is 5 or 7 times more than the high-end population based on income when they have it in a very close proximity. So this model of urban sprawl is definitely having a huge impact, and COVID made that quite evident in terms of access to public health. For example, in Mexico, when people, the mortality rate and infection rate was much higher in the periphery of Mexico City, where you had 2 factors. That travel distance to public health facilities was much longer, and secondly, access to potable water in their houses was very low or non-existent. So the hygiene of washing their hands was not possible, and that increased the rate of transmission of the disease. So I think that model has to change. That's what I wanted to make as a point.
It's interesting too, the role of the large corporation, coming from the perspective of a large corporation, I think is something that I've been both interested in and struggling with, to be candid. So, when we build a medical facility, again, we tend to buy the land that we need and develop what we feel we need. And one of the things that we're actually trying, and we'll see if we're successful, is to actually buy sort of more than what we need, to look at a piece of land in one of our neighborhoods that's more challenged, that has significant access problems to things like fresh food, fruit, and other types of green space, housing, things like that, and to see if we can get into a multi-partner development with the community, to not just build ours, but to actually kind of look at the whole system. Maybe it's a microcosm of the system, but kind of grow our sphere of influence to try to see if we can solve more of, or address more of, the social and economic needs in that community, including things like housing and access to food, exercise space, green space, community gathering spaces. And it's interesting. I mean, it's going to be, we'll see how hard of a sell it is to kind of play this role of convener, developer, community organizer, all that, rather than just healthcare company as builder. And you have to wish me luck on telling that story and trying to convince our group to go ahead and buy a piece of property that's probably 4 times what we need, and then use that as a way to kind of look more systemically at the services that we're providing. I know that's not a whole city, of course, or urban planning, but for us, it really challenges what is our role, and recognizing that we have a voice. Certainly in our markets, we have a strong voice that matters and could have influence. And the question is, how do we use it, and how do we rethink how we use it? So it'll be an interesting conversation, to be sure.
I want to really encourage you to do that. I mean, Kaiser's a huge HMO, and you do have a huge impact. And there are other models, I'm sure you know, Cleveland Clinic, and they're of actually even hiring local organizations to do the laundry. You know, so it's a huge, you know, you do a lot of laundry in a hospital. Who gets the contact? And so I just sort of think about it in a more holistic way, as opposed to we're just providing medical services. And in Detroit, which is where I'm from, you know, Henry Ford Hospital is one of the biggest employers in the city, and they're starting to think about housing and campuses. So I think thinking beyond, because you're going to have an impact. You know, if you don't,
one thing I would say, I'm quite proud of Kaiser. You know, one of the things when I had helped develop our new community health strategy, one of the things we talked about was where were we investing? You know, we obviously have huge pension investments and things like that, and whether there was room for social impact investing. And so when Bernard Tyson, our former CEO who passed away in 2019, he and I talked, and we ended up setting aside $200 million for that kind of investment. And the first investments that were made were in affordable housing, which I'm proud of. And I think one of the things that we talked about at some point in this work was we actually had a really focused conversation of what were our assets as an organization. You know, we tend to think of very traditional assets, but our voice was an asset. Our influence was an asset. Obviously our spending, as you talked about, so local spending with diverse and women-owned businesses, these were all assets, and they all needed to be rethought about how they were coming to bear on all these problems. And tremendous change has taken place with this new lens that we look at. So while the project I talked about will maybe be a hard sell, it won't be as hard as it was 10 years ago, which is, I think, a testament to kind of the expansive thinking about the role that our organization should play, particularly as a nonprofit tax-exempt organization. So.
Great idea, Jodie. Think about the co-benefits of that initiative. Welcome.
Yeah.
I think it's just such a prime example of placemaking, really, truly placemaking. And there's such an opportunity to bring constituents together that may not have even known to partner, and to have Kaiser, as you know, like as the convener in that relationship is so powerful, and sets an example for other healthcare institutions that should be doing the same thing more and more. So it's really exciting to hear, and I'm rooting for you. I hope it gets approved. I know, maybe if you talk about it enough publicly.
Maybe if I bring Pablo, you and John, maybe it'll get approved.
I mean, Jodie, part of why, you know, I wanted to bring the three of you together, other than, of course, that, you know, this is a fantastic venue for this kind of dialogue, is also because of this, right? It's so much around what can we do together, and how do we bring together disparately connected but very connected opportunities and people, and weave something that could be actually beneficial for everybody at hand. I mean, we've talked about so much, and like naturally we're coming into a close, and I think we've got a couple more minutes that we can be together. But I mean, I'd love to sort of close us out, also just to hear from you all, like you've been doing this work for so many years, right, John? You know, you've been, I mean, your career spanned so much, you know, from lawyer to professor to, you know, the leader of, my hands are going everywhere, to the leader, you know, at UC Berkeley at the Other and Belonging Institute. And Jodie, you know, with you, you've been at Kaiser for 20 years, right? Out of the 30-year, right? Out of your 30-year
not quite, but
healthcare, but almost, right?
Yeah.
And Pablo, I don't know how long you've been at the World Resource Institute, but I know that you've been doing this work for a really long time too. And I'm just curious, from what you've experienced over the past, let's say 15 years to now, what has been most sort of hopeful and surprising to you at the same time? And maybe those two things are the same.
Well, I'll start. So one of the challenges, I tell this story, I worked on the water issue in Detroit, which then became Flint 5 years ago, when no one was focusing on water. And I tried to get people to focus on water, and it was a rip-roaring failure. It's like, why are you talking about water? And then Flint happened, and then Flint was part of the Detroit system. It was cut off from the system. And it turns out, as you probably know, probably 70 to 80% of metropolitan areas in the United States are facing a water crisis. And I mention that because one of the things in terms of planners and researchers is that I feel like we're like weather people. We can see along the horizon. And by the time the water crisis hit Detroit, we were deep in trouble. and we had lost 2 or 3 years. And now everybody's scrambling, trying to figure out what to do with this archaic water system where half the water is lost underground. The water and sewage is mixed together, not properly cleaned. And the solution taken by the city was a political solution, not a planning solution. So to me, that's concerning, because I think there are these huge problems in terms of cities, in terms of climate change and changing of rivers rising. Katrina was a wake-up call that we refused to wake up from. So I think one thing that's different, I feel like sectors like Kaiser, sectors like corporate sectors are taking more notice. They're not just taking as much resources as they can. They're not all of them, but there's an open crack for a kind of partnership, and a partnership with the community. And to me, while the community appropriately is still suspicious, it's actually an incredible opportunity if we can seize upon it and do it right.
You know, I would say, Rima, to John's point, I'm so hopeful because it's not as hard to explain and convince people of the need to do this type of work. It's amazing to me when I talk to people, whether they're inside my own department or our leadership team or people outside Kaiser, there's so much understanding of the need to do this and so much interest. It doesn't take, despite my last comment about that project, it doesn't take as much convincing anymore than it once did. I think there's such an understanding now that particularly, health and well-being is impacted by so much more than the health care that we provide. It's a much more complex system. And I think there's so much more willingness to partner and understand that these problems to be truly solved are not going to be solved by one company, one individual, one industry, even alone. And there's just more understanding of that and receptivity to that than I've ever seen. And certainly COVID, as devastating as it was, shed such a light on this that if there were people who didn't understand, they understand now. I think there are so many more people who do. And I think the role of the corporation has changed so much from the 30 years ago that I started in terms of responsibility. And I don't mean, traditional corporate social responsibility. I mean real responsibility. John, to your point, that it is corporations that serve people, not people who serve corporations' interests. So I feel like it's not universal, but it's better, I feel like, than it's been in quite some time. And that makes me hopeful.
Yeah, to me, there are two things, and I just don't want to expand too much. The first one is collaboration, and collaboration. This is planning communities or revitalizing neighborhoods or doing a project like the one you mentioned, Judy, requires collaboration between different expertise and avoid the silo thinking process that used to dominate the process of planning or master planning, as it used to be called, and is not viable anymore and not applicable anymore. And then the other thing is, over the last decade or so, I think we realized how useful is evidence-based research, data that you can analyze and really guide your decision-making or your conversation with the community to make the right questions with them about what is needed in their community. If it's something really about water requirements, potable water, or if it's a park, if you have data that can robustly reinforce your suggestion and your argument, is going to make the whole process much easier.
Yeah. Well, thank you all. This has been such a fantastic conversation. I love hearing, I loved hearing, Pablo, kind of your real kind of your perspective on sort of future cities and really sort of the tactical opportunity that we have at hand to be able to overcome some boundaries, but also understand them. I think just from even in talking to you, some of the things I thought I knew were completely disrupted in some ways. And I'm like, oh, I never thought about it this way. So I think this is part of what the goal of this conversation too, is like, how do we bring these three kind of very like enmeshed kind of industry, so to speak, in a way that's going to open up people's minds and their hearts to this these endeavors, and actually make us want to, even if we're not in the city planning or in urban development or in not necessarily directly working with constituents that can make change. How do we make change on our own? Because we are people living in neighborhoods, in communities that can prioritize to be inclusive and to create belonging, that can prioritize other people's access to technology and our own kind of, and understand our own privilege in the context of others. And I think that's all sort of, it's all just about being human, right? And like you said, John and Jodie, you know, the in relationship part is such a big part of all of our work. And how do we do that better together? Thank you all.
Thank you.
Thank you, Rima.
Thank you.
I think you should call this Better Together.
I like that.